Good morning, ladies and gentlemen. It's my honor to be here as a presenter in the second symposium of the RAPID. I think that this is a remarkable initiation of the international collaboration, and I'm happy to be here as one of the collaborators. Thank you for the kind introduction, and thank you for inviting me in this beautiful symposium. Today, I'm going to present what we are doing in KDCA. Dr. Zhang told me that she needs me to present what we are doing to combat against AMR. So I prepared some, oh my God, I'm sorry. I prepared some slides to introduce what we are doing and some projects what we are now conducting. Okay, this is a simple organogram to present where we are. As I said, I'm in the division of antimicrobial resistance. As I said, I'm in the division of antimicrobial resistance research, and we belong to the Center for Infectious Disease Research. And the Center for Infectious Disease Research, it belongs to the National Institute of Infectious Diseases, and we are in the Korean National Institute of the Health. And we also in the Korea Disease Control and Prevention Agency. As I present here, our role can be represented by those three symbols. We are doing the work. We are responsible for the core glass and One Health AMR research and WHO AMR Collaborating Center. I simply presented the building blocks we are now conducting as a researching division. We are now doing 5 important researches to combat against antimicrobial resistance. The first one, we are constructing a surveillance system for antimicrobial resistance and antimicrobial usage. And we are developing intervention method for antimicrobial resistance dissemination, and we are researching and developed the diagnostic methods and therapeutic options for including antimicrobial drugs. And we also construct infrastructures for the researchers working on the antimicrobial resistance. As you see here, they are not individual building blocks. There is an organizing link between the building blocks. For example, we know where we have to make the intervention method to interrupt the dissemination by the surveillance system. And then we know where we should make a what kind of diagnostic methods are needed and what kind of antimicrobial drugs are needed through the surveillance study. And then we use our infrastructure by ourselves, and we provide that infrastructures to the other researchers to combat together against the AMR. Yes. And this is the investment in 2024 for each research field. As you see here, the antimicrobial resistance research should be conducted for bench research and for field research. So we investigated 65 versus 35% of the budgets to bench research and field research, respectively. Okay, this is the main part of my presentation. This is the major issues of AMR policies in South Korea since 2016. In 2015, there was a big the United Nations and the WHO, they needed us to involve in their collaboration to combat against the AMR because it was a big problem and big threat to the public health. So in 2016, we made our first national action plan on AMR. So based on that, we established our first pilot study for co-glass, and then which is harmonized to the glass system in WHO. And in 2017, the interministerial agreement of the collaborative project was started. And in 2018, we were nominated for the planning project for the multi-ministerial collaborative project. And in 2019, we initiated the multi-sectorial joint project of 7 ministries to One Health approach against AMR. And then at that time, we started the collaborative project with 6 ministries. And in 2020, the Rural Development Administration involved in this collaborative project as a 7th ministry. And in 2020, in 2019, we started our One Health AMR portal system. It is a big infrastructure to provide the antimicroresistance data to public. And then in 2021, we designated a WHO Antimicroresistance Collaborating Center. And the second National Action Plan on AMR was started in 2021. And in 2022, we opened our antimicroresistant isolate bank in our division. It is open for public. And we were nominated as a planning project for the second phase multi-ministerial collaborative project. And in 2023, our project was nominated as a multi-ministerial collaborative project. As I said, one of our 3 major goals, that is a national reference lab for co-glass. This is one of our major projects. This system is composed of 3 parts. The first one, that is operating committee. We are collecting bacterial species from clinical samples in 10 surveillance sites. And then we have 7 centers for analysis specialized for the bacterial species. And the bacterial species which were collected in the surveillance sites, they send the bacterial species to the analysis center, and then they analyze the bacterial species in a harmonized method. And then we have the Center for External Quality Assessment. So any kind of data, any kind of surveillance sites, any kind of centers which belong to the operating committee, they have to do some tests for external quality assessment. And this operating committee provide integrated information to KDCA. The KDCA, it is composed of, it has 2 major centers. The first one is National Coordinating Center, and the second one is National Reference Lab. The National Coordinating Center, they collect the data and evaluate the data, and then they send the data annually to WHO GLASS. And as I said, we are National Reference Lab. and we do the external quality assessment, and we conduct the QA and IPT to all the operating committee, and we give a regular validation data to them. So we report annually the national AMR surveillance data to public, and you can find the book in our website. It is very hard to say that the AMR is a big issue in South Korea in one slide. So I prepared this representative slide to say that we have a big issue for the AMR. Actually, those are very important multi-drug resistant bacteria in clinical settings. If we are infected by those bacteria, sometimes we can be struggled by finding some proper drug to use. So as you see here, the MRSA, methicillin-resistant Staphylococcus aureus, they are decreasing from the first National Action Plan on AMR, but they are still 45.2%, which is quite high. And as you see here, VRE, the vancomycin-resistant enterococci, they are still high. And cephalosporin-resistant E. coli, they are also very high. And the fluoroquinolone-resistant E. coli, they are also high. And as you see here, the last one, carbapenem-resistant Acinetobacter baumannii, we can find its high resistance up to 90%. So if anybody has some infection by the carbapenem-resistant Acinetobacter baumannii in ICU, we only have limited antimicrobial drugs to treat the patient. And this is our multisectoral joint project for One Health AMR. As you see here, as you may know, antimicrobial resistance is not the issue. It's not the only issue for human beings. It's the issue for multisectoral elements. So because antimicrobial drugs can be used in human, animal, and agricultural field, and they can be emerged and disseminated from any part of the sectors, and they can cross the intersectoral interfaces. So we need to do some collaboration to combat against this issue. So we made this beautiful project, multi-sector joint project for One Health AMR. It is started from 2019, which I have already said, and the KDCA, which are responsible for the human health, we are the leading agency for this project, and 6 other agencies are participating in this project. We do the work under the vision to protect citizens from the harms of AMR. And we made 2 objectives. We made objective R&D on the mechanisms and transmission of AMR in human animal environment to establish national measures for AMR control. And we do the work under the 5 key strategies. Actually, we conducted this project with a lot of money. So, but we couldn't put all the money for one special part. So we divided. We made a plan to invest the budgets to 5 priority technologies, and we used this amount of money. And as I said, we have made our own infrastructure which is open to public. So it's to support our other collaborators in South Korea, as well as in the other part of the world. The first one is One Health AMR data portal system. We put all the data from the 7 ministries together, and we put it into a database. So it includes national data for the rates of antimicrobial resistance, national data for antimicrobial usage and sales, and research subjects run by participating ministries. So, and then now we are planning to make our genome database for the bacterial species, for the bacterial strains collected from human, animal, and environment. And then we are gonna make a correlation with some antimicrobial susceptibility data to provide our colleagues, the global colleagues, to use the data and the bacterial species for their research work. And as you see here, AMR isolate bank, that is the part of that database construction. So actually, we are already providing our bacterial strains to public, but if we are thinking that if we make a connection with our genome data to our isolate data, it might be much stronger. And this is schematic view of our next project. It will be started in 2024, and it is the second multi-ministerial One Health AMR project. We are gonna do the work under the vision to ensure a firm health of human, animal, environment through the secure technologies to control AMR. We have 2 objectives. The first one is to construct a sustainable One Health AMR surveillance system. And the second is to research the technologies for the transmission intervention and inducing AMR. Yes, we have 5 key strategies, and you can have a look what we are doing. Thank you for your attention.